Okay, well, we've got Peter Jones here. Thank you, Peter, for volunteering to talk. And I'm really interested for our audience to hear exactly what you've been doing in the Solomons.
Yes, well, in the Solomons, we've been having clinical placements for our students there for about the last 10 years. Uh, Students were out on placement in a remote province called Makira province in Kirakira, which is the capital of Makira province. And capital might sort of make you think of a big city, but it's actually a village of probably about 3,000 or 4,000 people. And it's an entirely different world from what we might experience in Brisbane or the Gold Coast about 3 hours away.
Okay, thank you. Now, the next question I want to ask is what motivates you to do this?
Look, the main motivator is one of the very first responsibilities I was given as a new clinical academic, when I started at Newcastle Uni in 1995, was I found myself with the lofty title of Chair of Self-Directed Learning. And this sounds incredibly important for somebody, and I was about 30 years old at the time and about 1 year away from getting my letters and had my exam and all of those things that make you feel quite confident as a young fellow to be. But Chair of Self-Directed Learning meant that you got to read all of the elective reports for the students. And in Newcastle, students used to go out on an 8-week elective in year 3 and another one at the end of year 5. And I think when I read those reports, on many occasions, the elective experience appeared to be an incredibly rich experience. But on other occasions, there was a real concern that you might have had students attempting to do neurosurgery in the hills of Papua New Guinea because there was no one else who could do it. Or it really seemed that the student was there to have fun on a unsuspecting clientele where they were probably acting without the supervision and and far beyond their level of competence, and that kind of thing concerned me. So I was really driven to try and also the final thing that concerned me was the fact that everything seemed to be a once-off. And although the medical school were employing me to read the elective reports, there wasn't anything else in terms of engagement or responsibility from the medical school for what the students might be doing during these rather substantive pieces of the medical curriculum. And I thought that really it was a tremendous opportunity to still offer students choice, but make these experiences really very, very good with just a little bit of support so that there was ongoing engagement between the medical school and the place where students went. And I always thought that was something I'd like to do. And that feeling that there was difficulties with the elective, that was only further enhanced when, before I was appointed to be the Dean of the Medical School at Bond back in 2011, I'd been the head of year 3 and 4 and like a deputy of the medical school at the University of Queensland. And they had a great big giant class of about 450 students a year. And look, I once again had found myself engaging with students on elective and realising that not all electives were being conducted in any way perfectly, and the need for a little bit of structure led to me coming up with my own motto for being the chair of self-directed learning, and self-directed learning works best with direction.
I like that. I might steal it from you if that's okay. I'm keen to know what advice you give a student that goes out, say, first of all, from a clinical practice point of view.
Look, the advice I'd give to students is that don't underestimate the value of the basic skills that we've given you of being able to do a history, do a thorough physical examination, and make a judgment about what you think's going on, and what are the potential solutions you have at hand of a patient. And also, whenever we send students out on these capstone experiences, we always have students who've got, hopefully in groups of 2 or 4, so there's often someone alongside you, so that between the two of you, if you do your very best effort at a history and a physical examination, there's a good chance you'll be able to make a sensible assessment, and you just might be able to design a treatment plan within the scope of the available tools that you might have in the remote area and make a difference. And I think having students have the confidence that they don't necessarily need to be doing some procedure that they haven't done before to make a difference. They can actually make a difference through using the skills that they have and using them well, and trying their very best to execute a quality piece of clinical judgment.
Okay. Now, students also, and junior doctors or doctors going out into low and middle income countries, often take up an educator role. What or are asked to provide an educator role. What advice would you give to someone in that situation?
I think in that situation, it's about trying to get your language and communication pitched at the right level for your audience. And it's important to remember that although where you might come from, you might have a wealth of textbook knowledge because you've had access to the very latest information, you'll actually be speaking to an audience that in most ways is much more experienced about the clinical presentation of disease and patient and illness that might be there in front of you. And sort of, it's very important to be very humble in your particular presentation and recognize that your opportunities to have access to this knowledge is a little bit of a privilege, and the learning when you're actually giving training to nurses or doctors in these low and middle income countries is very much a two-way street. So that in you giving this learning, you're actually giving opportunities and making sure when you're giving such a presentation, you try and think through, how could my audience contribute to this particular presentation so they're a part of it and they're able to show their skills? Because many times when the students come back from an experience in a place like Kira Kira or in Gujarat, or even when they've gone to South Africa, they make a comment about the great amount of skill and ingenuity and innovation often the staff have been able to demonstrate in how they've able to execute a care plan with so very little resources that works. And I think always being cognizant of the fact that, yes, sometimes they appear to be paddling along in the dark without a proper diagnosis, but other times they seem to have made quite a clever diagnosis, and you really need to be ready and willing to help yourself learn from them what they're able to understand, so that you're helping to facilitate some of the gaps in their learning through your presentation.
Thank you. I really like that idea of humility. We talk a little bit about cultural humility, as a thing. But I think educational humility is another thing.
I think it's a very important thing, because often, you know, in whatever field you're working in for medicine or healthcare, there's always a feeling that you've got to have a little bit of respect about what somebody else is bringing to the table when you're managing a complex patient, and you might be, and as the general pediatrician, you've often got a range of opinions that have helped you formulate the diagnostic opinion that have each made a contribution, and you couldn't have done your job without them. And similarly, you know, trying to be open enough so people feel comfortable in having that kind of conversation with you, that you're not going to appear snobby or up yourself or speaking down to people because you know better. I mean, it's a very important thing to realise that I can and I do have such respect for how the doctors and the nurses, say in a remote place in the heat of Kira, are able to turn up to work each day and still keep on treating a great number of patients successfully, even though they'd have many reasons not to get out of bed in the morning if they thought too deeply about the challenges that they face.
That's a good, inspiring thought for all of us, I think. Now, as a personal question, how's your involvement in providing medical care and education in a developing nation changed you?
Look, I think it's made me have a great deal more respect for all of the things that we have in Australia. It sometimes made me realise that, you know, if I could ever calculate the medical waste, and not just in the terms that, say, my colleague Dr. Doshi does in terms of physical waste from an operating theatre, the idea that, gosh, when's enough? How can we make sure that we, you know, I think it's probably changed me in being able to explain that sometimes people have solutions to problems like this that didn't necessarily involve direct doctoring or medicine or therapy, and recognizing sometimes the strength of community and family in helping people recover from illness. And I think as you get older and you continue to practice medicine for longer, some of those ideas that might come across in an environment like an Aboriginal medical service, where there's a real focus on the whole patient, or maybe connection to community or connection to land, that some of these ideas aren't very alternate. They're actually quite fundamental to helping societies be successful. And I think that idea that although you might be privileged to be called a specialist, often in the practice, it's trying to give you skills in a way so that they're readily accessible to as broad a spectrum of people as possible, and recognizing that in giving those skills and that advice, you're not really that indispensable after all. So I suppose that was a long answer.
Comes a bit back to humility again. But thank you. And the final question I wanted to ask, it's more specific to this context or to the Solomon Islands. What does cultural competency look like in the Solomon Islands?
I think cultural competency in the Solomon Islands is appreciating the people and how they get along with sort of how they get along with life, and I think that idea that they do just a lot of being happy with where they are, without necessarily getting too focused on the next minute, the next second, the next bit of treatment. There's a sort of acceptance for what the outcomes happen to be that allows them to sort of get on with life, even when tragedy or challenges are thrown at them. And so I think that capacity to be accepting of the moment is something that I admire amongst the people in the Solomon Islands, and also that idea that they really dislike it if somebody gets really angry or yells or screams or carries on in a certain way. So in their country, that kind of showing of an emotional tantrum is a bit of a taboo thing. And that almost sometimes becomes a bit of a weakness, where they'll shy away from things like pain relief that we'd seek, because pain would be something that has just happened to you and you should have to deal with. Whereas we have an experience where if we're able to treat that pain, we might help the patient get better. And sometimes, you know, that's a really interesting cultural conflict that you might have when you're managing patients who you might be seeing a young lady that's just had a baby and has a tear from a delivery where she may have had an episiotomy or not, and they're just stitching her up, and she's just, you know, has, you know, almost feels like she's apologizing for having an expression on her face that says, "Oh my God, I'm in incredible pain." And you might be standing there watching this, feeling very, very anxious about it. But then it comes back to that being that is the person in the Solomons that just has a sense of acceptance that we don't have in our culture. And I think it's something that you sometimes wish that maybe it'd do me the world of good to have it. But, you know, it's often when cultures collide to realize when you're feeling uneasy in a situation, there might be something about your upbringing that's just not quite the same as the other's upbringing, and just being able to go with that and accept it for what it is sort of a valuable lesson that I think the people of the Solomons teach me whenever I go there and spend a week or so with them a couple of times a year over the last decade.
Right, thank you. Look, there's an awful lot there for people to learn and take away, both in inspiring and motivating people to make a contribution in this way. How rewarding and how important it can be, how it changes us. And some of the important lessons about being humble about what you know, what you don't know, the respectful of the contribution that others make, and just being able to knowing that you can make a difference with simple things. So there's some really important lessons in there. Thank you very much for your time. And good luck with the work.